eye, I'm going to follow my evidence-based checklist, privacy, safety, proper body mechanics throughout this assessment. I'm going to introduce myself. Hello, I'm Mariah Aderman. I am a second-year Spoon River College nursing student. What's your name and what brings you in today? I'm going to assess their level of consciousness by asking them the time, date, place, and situation. I am going to give them 2 words to repeat back to me now and at the end of this assessment, and the words are sock, blue, and bed. I'm going to be looking for tone, sentence structure, and quality. I am then going to assess their dress, their groom, their hygiene, motor behavior, and facial expression. And then moving on to vital signs. So a normal blood pressure is 100 to 119 over 60 to 80. Pre-hypertension is 120 to 139 over 80 to 89, and hypertension is anything over 140 over 90. Normal pulse is 60 to 100. Bradycardia is below 60, tachycardia is above 100. Temperature 98.6, and it's orally, rectally, temporally, and axillary. And then your normal respirations for an adult is 12 to 20. And for SpO2, 95% and above is normal unless you have COPD, then 88% and above. And then you would choose a pain scale appropriate to age and literacy. Then we would move on to inspecting the head and the face. So I'm going to look at the size, shape, position of the head. I'm going to inspect the scalp. I'm going to look for body hair and scalp hair distribution. I'm going to inspect the quality, or the quantity, color, and texture of the hair. I'm also going to look at the scalp condition, note any lesions or pediculosis. At this time, I can also palpate and feel for any, for scalp mobility, masses or nodules or tenderness. And then I'm going to look for symmetry and facial expression with the face. Moving on to the neck, I'm going to palpate the cervical lymph nodes. So I'm going to start in front of the ears, moving in circulation back, down the chin, and then down either side of the trachea out to the clavicle. And I'm also going to note the skin condition, range of motion, and position of the neck. And then I'm going to note the size, shape, symmetry, temperature, tenderness, position, or mobility, consistency of any palpable nodes. And then I'm going to palpate to the thyroid. So I'm going to stand posteriorly behind, have her flex her neck forward and to the left. And then I'm going to palpate for the cricoid cartilage. And then I would have her swallow, and I would displace the trachea to the left, and while palpating in between the cricoid and sternocleidomastoid muscle, and feel for the thyroid as it moves up, and I would do this on either side. And then I would move to cranial nerve 1, and that is olfactory. So I would use the, I would first examine the external structures, and I would look for size, shape, position, any discharge or flaring. I would then have her occlude a nostril and check for nasal patency, and have her occlude and then breathe in, and then repeat on the opposite side. And then if we didn't have a mask on, I would have her tilt her head back. I would examine the external structures, and then I would transilluminate the frontal and maxillary sinuses. So frontal, I would look for the glow return at the top. Maxillary sinuses, I would go right here and underneath the eye and look for the glow return in the roof of the mouth. Then I will palpate the frontal and maxillary sinuses and the external features, and then this time I would perform the smell test. I would have her close her eyes and occlude one nostril, and then she would smell and identify, and then we would repeat on the other side. And then we're going to move to cranial nerve 2, which is optic. So we're going to use test distance vision by using the Snellen chart. I would have her wear corrective lenses if needed. We would be at 20 feet from the Snellen chart. I would test eyes singly and then together. I would record my findings. And then I would also test color vision by using the color bars on the Snellen chart or following up with Ishihara cards. And then moving on to cranial nerves 3, 4, and 6, so trochlear, oculomotor, and abducens. I'm going to check for Perla. I'm going to use my pen light and pull it up and check for pupil constriction. Okay, and then I will go down to center of nose, have her follow the light or the pen light, and then do the 6 cardinal signs of gaze. Trying to make this slow so I don't make you sick. And then record my findings, and then I would move on to inspect the external feature of the eye. So I'm going to look at the color and the alignment of the eye. I'm going to note symmetry and distribution of the eyelashes. I'm going to inspect the eyelid for any lesions, lid lag, or edema. I'm going to inspect the lacrimal ducts and glands for any edema and drainage. I'm going to assess the color contour and moisture of the conjunctivae. I'm going to assess both bulbar and palpebral conjunctivae. And I will also inspect the sclera. I'm going to note the color and if there's any lesions present. Okay, so now we're going to move on to musculoskeletal. And I'm going to compare bilaterally. I'm going to look at the body posture and alignment from the front, back, and side. So the first thing I'm going to do is I'm going to have her stand. And I'm going to look for any curvature of the spine. So I'm going to have her standing with her arms at her side, just straight, okay? And then I would have her bend, and with her arms hanging, there, okay? And then dangling at her side, and then we're going to look at her gait and her basic support, so the distance between her knees, so have you walk. Okay. And then we will perform a balance test. We will have you do tandem walking, and then heel and toe walking, hopping, deep knee bends, and the Romberg test. So I would just have you stand with your eyes open, and then with your eyes closed, with your feet together. Okay, and then we're going to test for accuracy of movement. So I would have you stand with your eyes open, or eyes closed, and move your finger to your nose, and then with your eyes open. And then I'm going to have you sit again, and we're going to test for muscle strength against resistance. So I'm going to have you rest my fingers, okay? And then we'll do biceps, triceps, legs, and ankles. So okay. And then, okay. And then we will, the grading scale for that would be 5 is normal, 4 is slight weakness, 3 is weakness, 2 is poor range of motion, 1 is severe weakness, and 0 is paralysis. And then at this time we will do active range of motion. So, you want to stand to a second? Mm-hmm. You're good?
Yeah, go ahead.
Okay. So you would do, the neck is flexion, extension, hyperextension, lateral flexion, and rotation. The shoulder is flexion, extension, hyperextension, abduction, adduction, circumduction, and then external and internal rotation. And then the elbow is flexion, extension, supination, pronation, and then your wrist, flexion, extension, hyperextension, abduction, adduction. Your fingers, flexion, extension, hyperextension, abduction, adduction, opposition. And your thumb is flexion, extension, saddle. And then your hip is flexion, extension, hyperextension, abduction, adduction, external rotation, internal rotation, circumduction, and then the knee is flexion, extension, your ankle, flexion, extension, eversion, inversion, and then your toes, flexion, extension, abduction, adduction, and then your trunk, flexion, extension, hyperextension, lateral rotation, or lateral flexion, and then rotation. Okay, and now we're going to assess cranial nerves 5 and 7, so trigeminal and facial. And I would have you wrinkle your forehead, puff out your cheeks, clench your, or ground, oh my goodness. Frown, grin, and then puff out your cheeks, and I would palpate the temperature, oh my gosh, masseter and yeah, that one, muscles, and then I would do sharp and dull at this time, or I can do it later, and I'm going to do it later. Moving on to cranial nerve 8, which is acoustic. I'm going to first inspect the tympanic membrane. So I would hold my otoscope upside down, have my hand, I'm going to go to the side so they can kind of see what I'm doing. Have my hand in between her head and the otoscope. For an adult, I would pull it up and back. For a child, down and back. And look, and it should be a pearly glossy white. And then I'm going to perform the Weber test. So I would strike the tuning fork and put it in the center of the head. It should be heard evenly on both sides. Then I would strike again and do the Rhine test. I would put it on the back of the mastoid bone. And whenever she can no longer hear it, I would move it to the front. And it should be heard twice as long on the front than it is on the back. And then I will perform the whisper test. So I would have her occlude one ear, and I'll stand behind her, and I'll whisper 2 syllable words. So,
Okay.
and then,
Hot dog.
okay. So, now I will move on to cranial nerves 9, 12, no. 9, 10, and 9, 10, and 12, and they are glossopharyngeal, vagus, and hypoglossal. So I would check her voice hoarseness by having her say light, tight, dynamite, and then I would have her stick out her tongue, move it side to side. I would use my pin light, have her open her mouth and say ah, and then check for uvular placement. And then I would also use my tongue depressor, and I would check for gag reflex. Okay, so then moving on to cranial nerve 11, which is spinal accessory. So first thing I'm going to do is I'm going to look for symmetry and deviation. I would inspect the condition of the skin. So the first thing I'm going to do is I'm going to check for muscle strength by having her push up against my shoulders and move towards resistance with her head, with her neck. Okay, and then I will then do superficial sensation. So I would have her close her eyes, and I'm going to start with the most peripheral part of the limb. And I would do, if there's any sensation loss, I would move about an inch every 2 seconds. And if there's any sensation loss, I would map that out. I would first test with cotton point. If there is any abnormal pain perception, I would test with temperature perception. Then I'm going to move on to discriminatory sensation. So the first thing I'm going to do is sterignosis. I'm going to have her close her eyes and hold out a hand. And I'm going to place an identifiable object in her hand and have her tell me what it is. Okay. And then we would repeat on the other side. So have you pick up the other hand. Okay. And now we're going to test graphesthesia. So I have her hold out her hands with her eyes closed, and I'm going to write a number or a letter. I'm going to do a letter, so you just tell me what the letter is.
Okay.
Okay. And then the number, I'm going to do a number on this hand.
9.
Yep.
6.
Okay. And then I will do 2-point discrimination, 2-point discrimination. So I'm going to move I'm going to use your back. I'm going to move 2 points simultaneously together until only 1 point is felt, and then I'll measure the distance in between the 2 points. Okay, now we are going to move on to heart and vascular. Maybe, hold on, let me think. Deep tendon reflexes. Okay, so I'm going to take my percussion hammer, and the biceps is a C5 and C6. And I would have her hold her arm like this, the non-dominant hand holding my thumb over the bicep, and strike with the percussion hammer. It's probably backwards, it feels backwards, but and then the tricep, using my non-dominant hand to hold up, and I would strike the percussion hammer about 1 to 2 inches above the acromion process. And that is a C7 and C8. And then the brachioradialis, I'll just use this hand so you can kind of. This is a C3 and C6. Let me move over, sorry. And then I would use the bony prominence on the thumb side and strike about 1 to 2 inches above. And then the patella reflex is an L2, 3, and 4. And I'm going to strike just below the patella. And then the Achilles reflex, which is an S1, S2. I'm not really going to strike you, but you would strike the Achilles tendon. And then before I do the grading scale, I'm going to do the Babinski reflex. So you would take, I'm just going to use the sharp end of this, and you would go laterally. And if you look for this in newborns, their toes should curl up. And then the grading scale, 0 is absent, 1 is diminished, 2 is normal, 3 is increased or stronger response, and 4 is hyperactive with clonus. Now I will go to heart and vascular. So the first thing I'm going to do is I'm going to have her lay supine. Sorry, Cassie, you're going to work out in today. And I'm going to note the condition of the skin. I'm going to inspect the carotid arteries and jugular veins for any pulsations. I'm going to rate the rate, rhythm, depth, amplitude of the pulse. And then if I needed to, I could massage the arteries one at a, or not massage the arteries, you don't want to massage the arteries. I would palpate the arteries one at a time, being careful not to occlude the artery. And then using the bell of my stethoscope, I would have her hold her breath and I would listen. And now we're ready for heart sounds, so I'm gonna have her sit up again. Need help?
No, I'm okay.
Okay. So your aortic is a S1 sound, or is an S2 sound, and it's at the second intercostal space right of the sternal border. Your pulmonomic valve is at the second intercostal space left of the sternal border. Erb's point is an S1 and S2 sound, and that is at the third intercostal space left of the sternal border. And then your tricuspid valve is an S1 sound, and it's at the fifth intercostal space left of the sternal border. And then your mitral valve is an S1 sound, and it is at the fifth intercostal space mid-clavicular line. Also your apical pulse. You're going to look for any murmurs. You're going to listen for any murmurs, and then you are going to assess the periphery. So I'm going to assess the color, temperature, edema, and then I'm going to palpate the peripheral pulses. So I'm going to palpate the femoral, the brachial, radial, femoral, apical, popliteal, posterior tibial, and your dorsus pedis. I'm going to then look at the rate, rhythm, depth, symmetry, elasticity, and amplitude of the pulse. And the grading scale would be 0 is absent, 1 diminished, 2 is normal, 3 is full and increased, and 4 is bounding. And then I'm going to assess the venous system. I'm going to look for any varicosities, and then valve compression test. Okay, and then cap refill, less than 2 is good, greater than 2 is poor. And then your edema grading scale. So 0 is no edema, +1 is mild with 2 millimeters of depression, +2 is moderate edema with 4 millimeters of depression, +3 is pitting edema, and it is 6 millimeters of depression, and +4 is very deep pitting edema with 8 millimeters of depression.
Do you know the seconds, just so I don't have to...
Oh no. I know the first one's quick rebound, the second is 2 to 6, and then 3 is 10 to 12, and 4 is slow rebound, 20 seconds or greater. Okay, and then I think we're ready for lungs and chest. Cap refill. So I'm going to do that. Less than 2 is good. And I'm also going to assess for skin turgor as well. So you can do it on her hand, or for baby you would do on the chest and the abdomen. And then we're ready for lungs and chest. So the first thing I'm going to do is I'm going to look at the respiratory rate. So I'm going to look at the rate, rhythm, and depth, skin condition, any spinal deformities of the chest, or spinal deformities, and I'm also going to I'm going to inspect the chest anteriorly, posteriorly, lateral diameter as well. I'm going to inspect the chest, so I'm going to look for, I'm going to palpate for any masses, crepitus, and skin condition, tenderness, there it goes, tenderness. And then I'm going to palpate for chest excursion, so I'm going to stand behind her, place my hands at the 8th and 10th rib, create a skin fold with my thumbs about 2 inches apart, and have her inhale and exhale and feel for chest expansion. And then I'm going to perform tactile thermitis. I'm going to have her say 99 5 times as I go down her chest. Okay, and then I will percuss over the chest, over the intercostal spaces rather than the bones. Okay, and then I will perform or check for diaphragmatic excursion. So I'm going to stand behind her again, and I am going to have her exhale, and I'm going to percuss over her back until sound change, mark the level, and then I'm going to have her inhale and hold, and mark down her back until sound change, mark, and then I'll measure the distance between the 2 points. Okay, so then I'm going to auscultate lung sounds. So I'm going to note that the right lung has 3 lobes, the left lung has 2. I'm going to listen posteriorly, anteriorly, and laterally. I'm going to listen through a full respiratory rate to each lung sound. So for her front, do 1, 2, 3, left upper, hold on, right upper, left upper, getting backwards, and then right middle, left lower, right lower, right lower. And I know I did that backwards, so I'm going to redo it at the end. And then in her lateral, listen to here. On the left side, on the right, it'd be up, middle, lower. And then with the lung sounds on the back, it will be left upper, right upper, left upper, right upper, left upper, right upper, right lower, left lower, right lower, left lower, right lower, left lower, right lower, and then right lower, left lower. Okay, and now I think I'm ready for the abdomen. So I'm going to have you lay supine with your knees slightly flexed. I will expose the abdomen. I'm going to inspect the condition of the skin, the color, the contour of the abdomen. I'm also going to note any hair. I'm going to note the hair distribution on the abdomen. I'm going to note the color, contour, and position of the umbilicus. I'm also going to look for any scarring, skin condition, striae, lesions, and any tenderness in the abdomen. I am going to go in the order of inspection, auscultation, palpation, and then percussion it's percussion and then palpation. And then I will, after I inspect, I will auscultate, listen to bowel sounds in all 4 quadrants. 5 to 30 is normal, below 5 is hypoactive, above 30 is hyperactive, and I'm going to ensure that if I think that bowel sounds are absent, I'm going to listen to each quadrant for a full 5 minutes. So, listen. Okay, then I will, after I listen to bowel sounds, I'm going to percuss. So, over multiple locations in the 4 quadrant, percuss over the abdomen. And then I would move to a palpation. So I'm going to do light palpation first. I'm going to move in 1 to 2 centimeters deep in rotation and multiple. I'm going to look for muscle resistance, skin turgor, any tenderness, and any ideal characteristics. And then I will deep palpate for the liver, spleen, and bladder. So for the liver, I'm going to be on the side of her, and I'm going to feel at the mid-costal I cannot say this word. Mid-clavicular line, and then parallel to the parallel to the left costal angle. I'm going to push in. I would have her inhale and exhale deeply and push in and feel for Murphy's sign. Okay. And then for the spleen, I will be on the left side. And I'm going to place my hand at the left mid-clavicular and left costal margin. And then the other one underneath. Have her breathe in, exhale, and push in to feel for the spleen. And then moving on to the female GU, I'm going to have you continue to lay supine in lithotomy or Sims position. I'm going to instruct my client to disrobe and expose the pelvic area. I'm going to look at the distribution and condition, or presence and condition of pubic hair. I'm going to inspect the mons pubis and labia for any lesions or discharge, and then using a gloved hand, I will I'll spread the labia and expose the clitoris, looking for size and position. And with the labia exposed, I'm also going to look at the urethral meatus and vaginal intritus, and I'm going to note the color, any lesions, any discharge, and then I'm going to have her bear down, and I would feel for any bulging, or look for any bulging or any discomfort. I will note that normal urine output is 30 to 50 milliliters clear yellow urine an hour, and then I would have her sit up, which you're good. I can come over here and do it this way. Palpate for kidney pain at the third lumbar and last thoracic vertebrae. Palpate. Okay, and then I would, palpate the lymph nodes in the groin, over the vertical chain, over the inner aspect of the thigh. I'm not really going to touch you. And then moving on to male GU, I would have him either, I would have him void before the exam, disrobe and expose the groin area. I would have him laying on his back, supine, with his legs slightly flexed apart, or standing, and I'd be at eye level with the genitalia. So the first thing I'm going to do is inspect. So I'm going to inspect the presence and condition of pubic hair. I'm going to inspect the position of the urethral meatus. I'm going to look at skin condition. I'm going to look at the foreskin if it's present, and I'm going to look for any lesions or discharge. Then I will assess the scrotum for size, shape, position, and then I will use a gloved hand and palpate the penis. So I would palpate for any lesions, nodules, masses, mobility, consistency, and then with the scrotum, I would palpate the scrotum, epididymis, and testes, and I'm going to palpate for consistency, mobility, nodules, masses, tenderness, and then I will palpate the lymph nodes in the groin over the vertical chain, over the inner aspect of the thigh. Okay, and then I'm going to inspect the breasts. I'm going to have her sitting, and first I'm going to note that I'm going to inspect the size, shape, and position and color of the breast, nipple, areola, and the axillae. I'm going to note hair distribution in the axillae. I'm going to inspect, I'm going to have her first sitting with her arms at her side, arms raised but not above her head, arms on her hips, and then arms bending forward, leaning over, arms dangling. And then I would have her lay, and then I would put a pillow under the breast being observed. And then I would inspect the nipples for any discharge or lesions, and I would get a specimen sample if there was any discharge. Then I'm going to palpate the breast using 3 different methods, well, one of the 3. The first one is your lateral strip method. So I would start at the sternal border and move in vertical strips. Vertical strip method, not lateral. Moving in strips until you hit the mid-axillary line, and then pie wedge, you would just move from wedge to wedge. And then concentric circles, you would start at the 12 o'clock at the outermost breast and move clockwise inward. I'm going to then I'm going to palpate the nipple and the areola. I'm going to feel for elasticity and tenderness, and then if there was discharge, I would use gloves. And then I would palpate the axillary lymph nodes, moving in a circular motion, and the clavicle lymph nodes. And I would then ask her to repeat the 3 words I gave at the beginning of this.
Soft blue bed.
Okay, and then that would be the end of my assessment. Okay, a couple things I forgot was that hypotension is anything below 90/50 or 90/60, and then whenever assessing the abdominal area, whenever they're laying supine, you're going to have them move their head forward, and you're going to look for any bulges or a hernia. If there is any bulging or a hernia, you're going to measure the girth from the girth to the umbilicus with a measuring tape. And then with the male GU, I also forgot to mention that you would look for any swelling or bulging in the inguinal areas. And I think that's all that I missed.